Hospitals in several states are reinstating mask mandates amid rising cases of the flu, COVID, and other respiratory illnesses. Masks are now required at New York public hospitals, health centers, and long-term care facilities. Healthcare systems in Illinois, Massachusetts, and California are also implementing new masking mandates. So for more on this, let's joined now by Tina Reed. She's a senior healthcare reporter for Axios. Tina, what more? So, I mean, I think a lot of people are going to watch this. They're going to say, look, we understand the importance and why masks can be safe and keep people safe, but a mandate is something that I don't know a lot of people in this country are going to want to see again.
Thank you for having me. So I think the first thing to point out that most officials are saying is they're not looking at a federal mask mandate. What we're seeing happening right now are hospitals in local places that are looking at their respiratory virus rates and are making decisions based upon their local conditions. When we think about hospitals, they're really worried about capacity, not only about their capacity to keep their doors open, continue doing surgeries, but can they continue having enough staff that are well so they can continue offering services. So that's really what we're seeing here.
That's a good point.
So is that what the hospitals learned from previous COVID surges, that despite the fact that, their vaccines are available, and so presumably, even if people get sick, and we've known people who've gotten COVID recently.
Just in the last couple of days.
Right. If they get sick, they won't get so sick that they have to go to the hospital. But have hospitals sort of looked at the previous surges and said, listen, let's take a look at our staff, let's take a look at our beds, let's get ahead of this?
Yes, so it's really important. A lot of them are being really careful to look at their local conditions. What are the wastewater surveillance rates telling them? What are their emergency department rates telling them? What we saw in St. Louis, they had a local citywide ordinance requiring face masks, and there was a lot of pushback because the hospital said, hey, we're seeing normal respiratory virus rates, and so they reversed that quite quickly.
This is the first season where we have vaccines available for the triple threat of RSV, COVID, and the flu. How will this help hospitals be better prepared?
So the idea is obviously to have less respiratory virus transmission. Unfortunately, a lot of places, we're continuing to see really elevated rates of transmission, particularly among people getting COVID. And a lot of that has to do with the fact that we haven't had a really high uptake in the latest boosters that are available, or the latest COVID vaccines that are available. Only 17% of Americans have taken those so far.
Do you have an idea of where we stand as sort of a country in regards to masks and vaccines? How are people feeling about it? Like in the middle of the pandemic, we would be constantly having these conversations about misinformation and why don't you trust this vaccine and da-da-da. But then we stopped having that conversation, and I don't have a good gauge as to where people are. Do they still believe the vaccines work? Are they getting their flu shots, their RSV shots, the latest booster? How do people feel?
Well, unfortunately, we have seen a really low uptake in the latest vaccines. I think this is really, it's really turning out to be very regional and also very much based on people's individual risk, because there are a number of people that are very vulnerable due to other illnesses they might have, maybe diabetes, asthma, and they do have to be much more careful than the rest of the general population. So they're living their lives a lot more differently than a lot of people who want to just be done with COVID.
Are health officials at all locally, again, understanding that these will not be federal mandates, but are they considering reinstating other pandemic measures?
So I really think this is being made on a case-by-case basis. I talked to one public health official in Ohio. She said the local hospitals were really watching it closely, but hadn't made a decision to move ahead yet with a mask mandate. So I think they're being really careful as they move ahead. It's being handled much differently from state to state as well. In Illinois, I believe the hospitals are saying, listen, patients and staff, you need to mask up when you're inside one of our hospitals or one of our nursing home facilities. At Mass General Brigham, they're saying that only staff really need to mask up.
All good information. We got to let you go. Tina Reed, thank you.